come in.
Hello, I'm Nathan. I'm going to be your nurse today. What's your name?
Jared.
Jared? Okay. Jared, how old are you?
12.
12? Okay. Are you just here by yourself today?
Yes.
Okay. Alright, well Jared, I'm going to go ahead and get your vitals and do a couple quick assessments before the doctor comes in. I'm just going to have you go ahead and stick out your tongue here. I'm going to check out your mouth and your throat. I'm going to go ahead and test your eyes too, so just go ahead and look straight forward at the wall for me. Okay, go ahead and focus your eyes on the end of my pen light. Alright, and Jared, are you in any pain or anything today?
No.
And at this point, I go ahead and grab vitals. I get his blood pressure, pulse, temperature, stuff like that. Alright, Jared, I'm going to go ahead and check out your skin. Can I go ahead and roll your sleeves up real quick for me? Go ahead and roll it up on that arm too. Do my 6 P's on him. Okay, and everything seems to be in order. Jared, can you go ahead and lay back in the bed? I'm just going to listen to your belly real quick. Go ahead and roll up your shirt for me. Alright, Jared, everything's sounding pretty good. I'm going to go ahead and sit up for just a second for me. I'm going to go ahead and take a listen to your lungs. Take some deep breaths for me. And Jared, are you just here for a checkup today?
Yeah.
Okay. Alright, your lungs are sounding pretty good. I'm going to go ahead and listen to your heart for just a minute. Okay, everything's sounding pretty good there as well. Jared, do you have any coughing or anything?
No.
Any runny nose, sore throat, anything like that? Okay. Go ahead and look at your hands real quick. You can go ahead and put your fingers out like that. You biting your nails or anything?
No.
Okay. Alright, go ahead and give my fingers a squeeze. Go ahead and pull them towards you. Push them away. Good job. Alright, I'm going to go ahead and check out your feet real quick. Alright, go ahead and pull your toes up. Push your feet down. Good job. At that point, I'd do my hand hygiene. And at that point, I'd pretty much be finished up with my assessment on Jared.
So when it comes to speaking to the parents, so if the parents were present, you would want to ask them about things such as, are they up to date on their immunizations? Do they have any other, health problems that weren't mentioned by the child? Have they been around anyone who's sick lately or anything like that? If they have pets at home, what kind of allergens they're exposed to, and if there were like any problems or anything when they were born. All right, so for this next one, I'm going to do a toddler. So when you're talking to the parents with a toddler, they're probably going to have to ask some of the questions that a toddler would not probably be able to answer. Obviously things about like their immunizations, if they've been sick lately or around sick people, if they have other health problems, anything about pets and allergies, any other health problems that the nurse might need to know about. You want to ask stuff like how potty training and stuff is going, how they've noticed their child's appetite is, and things like that. Alright, so in starting out an assessment of a toddler, you want to just ask them a couple questions that they would, be able to answer. So you would ask them their name. So this is Coda. So I would ask Coda, what his age is, and we'll say that he's about 3 years old. And he could probably answer if he lives with mom and dad. Then we would go ahead and start out with the assessment. Let me grab my pen light. So tell him Coda, I'm just gonna go ahead and check out a few things here, okay? And so I'm gonna go ahead and check out his eyes. And I would want to check out his ears as well. And everything seems to be normal. And I'd want to check out the inside of his mouth as well. And after that, we would go ahead and get vitals. So I would go ahead and get his blood pressure, temperature, pulse, respirations. Then I would ask him, I was like, hey, Coda, is it okay if I listen to your lungs real quick? And then go ahead and do my lung assessment. And I would instruct him to take some deep breaths for me. And while I'm here, I tell him I'm going to go ahead and listen to his heart as well. Okay, and when I'm finished with that, I'd tell him, I'm going to go ahead and do my neurovascular assessment. I mean, he might not, understand at that level, what I'm talking about. So I'd tell him I'm just going to check out his blood flow. And so I would, do all my 6 P's in his extremities. And then do the same in his lower extremities. Another question that a toddler would probably be able to answer for you is, if they're having any belly pain or anything, which could indicate, gastrointestinal issues or something like that. And then I'd ask Coda, if it was okay if I went ahead and just listened to his belly real quick. And so to have Coda go ahead and lay back. Then I'm going to want to feel Coda's belly, so I tell Coda that I'm going to feel his belly, and then ask him if there's any pain when I'm feeling around. And then I've already done my neurovascular. And then after that, you're pretty much finished with the assessment. So you want to be, interactive with the kid at all times. Definitely give praise to them and tell them good job for their interactions and cooperation with you and everything. If it's a toddler, you could probably give them stickers or a lollipop or something like that. And then you're all finished with that. And then you go talk to mom and dad. Okay, so for this next video I'm going to be doing, I'm going to be simulating an assessment of an infant. At this stage in life, an infant's probably not going to be able to speak hardly at all, and so the parents are really going to have to answer pretty much all of the questions. They'll have to answer anything about immunizations, if the child's been sick lately, any sore throat fevers, anything like that, any other health problems that they've noticed, any problems with genital urinary or gastrointestinal, any skin issues like rashes and stuff like that. If the child has seemed like they've been in pain or anything, because at that stage a child would probably not be able to verbalize being in pain. What their home life is like and what they might be exposed to, and things like that. So for this one, I would be simulating an assessment on an infant. You want to make sure you approach the infant as calmly as possible, so you don't startle them and so you can gain their trust for the assessment. So you start out, the parents would fill you in on their name and age and who all they're living with. And then you would want to go ahead and start your assessment on them. So we go ahead and check out their eyes. You want to make sure you look at their ears and their mouth. And then you're going to go ahead and do your lung assessment on them. And then you're going to listen to their heart as well as they're laying down. And it'd probably be a good idea to just do the bowel sounds at the same time too, since they're already laying down for you. And then you'll want to go ahead and feel around to see if there's any masses or anything where their bowels are at. You want to do all your 6 P's on their extremities. Do the same thing in their feet. And perform your hand hygiene. And then you're pretty much finished with your head to toe. And then any other questions that you might need to ask, like I said, you'd have to probably ask the parents, because at this stage in life, a child's really not going to be able to answer many of the questions for you, especially if they're not of speaking age. So.